Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. This is Urban Health Today, and I'm speaking with Gillian Barclay, Senior Vice President of Global Public Health and Scientific Affairs at Colgate-Palmolive. She's here to talk about the critical connection between oral health and overall health among children, as well as the Bright Smiles, Bright Futures program. Thanks for speaking with me today, Ms. Barclay.
Thank you very much for having me on, and I can't wait to talk about how oral health impacts children and their families overall and what we are doing at Colgate to address the issues.
Well, it's a pleasure to have you. Now let's get started. Please talk about your background and your work with Colgate-Palmolive.
So at Colgate-Palmolive, I lead global public health and scientific affairs, and I also lead the Colgate Bright Smiles, Bright Futures program, what I would call the eminent program in children's oral health and children's oral hygiene education globally. And we are the only oral care company with such a deep footprint, both in the US and outside the US in children's oral health and education.
Can you talk about Colgate-Palmolive's Bright Smiles, Bright Futures program, its inception and core objectives?
So the Bright Smiles, Bright Futures program was started in 1991. So it's been around, I can say proudly, for over 30 years. And its focus is reaching children with oral hygiene education, reaching them where they are. We say we reach them where they are born, live, learn, and play also. So we reach them in their communities, and we provide oral hygiene instruction, oral health education, nutrition education, also really focused on prevention and good hygiene practices. We partner with the dental associations here in the US. We partner with the American Dental Association, minority dental associations such as the National Dental Association, the Hispanic Dental Association, Society of American Indian Dentists, as well as nonprofit partners that have been with us since the inception. It's really almost impossible to reach children where they are unless we have the nonprofit partnerships that can help us on the ground. As well as, because we're in schools also, and we started off as an in-school program, we have very close partnerships with school districts also, and we partner with local public health departments. Wherever you would find a child needing oral health education, as well as other hygiene instruction, we are there in partnership with those local entities, at least here in the US. And outside the US, we partner with ministries of education, ministries of health also, as well as non-governmental organizations or nonprofits that work in partnership with us to improve children's oral health. And we do deliver our education in a culturally appropriate manner since we partner locally with organizations that are representatives of the communities and children that we reach.
The global reach of the Bright Smiles, Bright Futures program is impressive. How does the program tailor its approach to meet diverse needs of communities worldwide?
So what makes Bright Smiles, Bright Futures truly unique is the fact that we work through partnerships also, and partnerships that are truly representative and also invested in the issues that impact children's overall health and well-being, as well as their oral health and well-being. So for example, in the US, we work with school districts. Also, we engage school districts, teachers, parents, the nonprofits on the ground that are representative of communities by race, ethnicity, and so on. So not only do we reach children, but we reach them in what I would call a culturally appropriate manner also. And this has enabled us to deepen our footprints as well as expand our footprints in the US and abroad. We also work with local public health departments also, since oral health programs are also found not just in school districts, but also in public health departments. And outside the US, we work with ministries of health, ministries of education, and also NGOs that are also invested in ensuring children's overall oral health and well-being.
Question, in the US, what does that look like in the schools? What does the program look like in a school setting?
So in the US, we have a phenomenal in-school program that's virtual van visit as well as in-person mobile van visit. So we have 9 mobile vans that target specific areas across the US, and we actually partner with the school districts as well as our local partners, nonprofit partners, and we go into the schools with the van and deliver education, oral health education. We partner with dental associations also, so dentists volunteer on our vans. Colgate employees also volunteer on the vans. For some children, it's the first time they're actually seeing a dentist or a dental chair.
Wow.
And it's a fun, engaging experience for them where, you know, they won't have that fear or trepidation of going to the dentist as they you know, throughout life, as well as, you know, just instilling in them the fact that people care. You know, we care about them, their health and their future. We do oral hygiene education with them. We show them how to brush their teeth and so on. And we also, it's just not only oral hygiene education, but it's personal hygiene, but including oral hygiene education as part of their overall health and well-being. We also provide materials, educational materials that teachers can use in the classroom. All our educational materials are aligned to education standards as well as health education standards. So we know that through using our materials in the classroom, it also helps school systems meet their goals for education outcomes for children, like socio-emotional learning, improving literacy, and so on among children.
Well, as you know, cavities are the most chronic disease affecting U.S. children. What are some everyday oral hygiene habits that families might overlook, but that can make a significant difference?
So primarily brush twice a day, including at night, and definitely using fluoride toothpaste. We fondly tell our BSBF children and families, don't go to sleep with a meal in your mouth. You're just giving that meal to the bacteria in your mouth to cause cavities and so on. So it's really important to brush twice a day, including at night. And to also, if a child can floss, you know, to remove whatever teeth, food and so on may be in between the teeth. Also really important, we do nutrition education for children and with families. I mean, we know that what a child eats also contributes to having caries or decay or cavities, as we say. So high sugar foods also cause cavities. You know, so it's looking at healthier options that families can use or eat that would diminish the chance of a child getting cavities also.
Can you explain how oral health can affect a child's mental, social, and economic development?
So I usually tell people, you know, just imagine a child not having good oral health and the impact that that may have on a child's self-esteem. And it's just not the child only, but health. But we know, for example, I know there's data from the New York State Department of Health that shows that the 51 million school hours are lost annually because of dental problems in children. So what if we ensure that what if we move to a future where no child has a toothache or has a cavity, especially with it's so preventable. Caries is so preventable by good education, behavior, proper oral hygiene behaviors, as well as ensuring that a child has access to a healthy food system. We would diminish the potential that that child has low self-esteem, also difficulties with talking, speaking, also, and learning from just missing school because of toothaches.
Oh, wow. Has the COVID-19 pandemic affected oral health practices among children? And what
Well,
adjustments has Colgate-Palmolive made in response?
I would say the children that were most impacted by the pandemic are children who were already vulnerable. That's children who may not have had access to a dentist, children living in poverty also. And when you look at who carries the burden of cavities in the US, it's usually minority children, Hispanic and African American children, as well as children who are low income. Those are the populations that were already negatively impacted by the pandemic. So we should expect that we would see the same thing for issues in oral health in children. What we did during the pandemic is that since school systems went virtual to online learning platforms, we actually transitioned to virtual along with the school systems and worked with schools where we delivered oral hygiene education and other health education in schools during the pandemic. So our curriculum is already aligned to meeting education standards and health education standards. So it is expected that we also contributed to ensuring that children kept learning about good oral health habits, and that some of the schools were also able to maintain their curriculum standards around health education and education also during the pandemic. So we did that wonderful shift to virtual education during the pandemic.
Oh, that's commendable.
Mm-hmm.
What do you want parents and guardians to understand about the importance of early dental care?
As soon as that first tooth erupts, find a dentist. And baby teeth or primary teeth are just as important as adult teeth. I know culturally, some parents may say, "Oh, the child is going to lose those teeth anyhow. I don't need to watch those teeth." But the reality is that if a child has a cavity or cavities in the baby teeth or primary teeth, that child is more likely to have cavities as an adult. So it's important to start early on instilling good oral hygiene habits and to focus on prevention and to not wait until a child has a toothache. That's the worst time to actually address a health issue with a child when a child is in pain. And also looking at early dental care is really critical when you look at lifelong issues or health issues that can affect an individual. We know the evidence shows that poor oral health is also associated with diabetes. So the earlier you start investing in good oral hygiene habits and so on with childhood, during childhood, it transitions to adulthood also. And parents also need to mirror the habits that they want their children to adopt also. So it's just not only children learning good oral hygiene habits or paying attention to early dental care. Parents and older siblings should also maintain healthy oral hygiene habits. Prevention is key. Caries the number one chronic disease in children, preventable, very much preventable.
I remember when my daughter's pediatrician gave us the referral when she was 1 to see the dentist. And I remember just kind of giggling to myself because she didn't have, that many teeth back then. I have to tell you, I mean, obviously I took her, but she has 0 cavities, absolutely 0 cavities. She is, she gives me a hard time about brushing the teeth at night, but she does it, and she is probably the only child when we go to the dentist that doesn't have to stay because she doesn't have cavities. So I'm here to testify that starting early does prevent.
Well, that's I have to applaud you because that early investment sets up that child for a future of success. Also, when I say success, understanding how to take care of oneself also and prioritizes prevention is key. It's just not oral health. It carries across to everything else. So, so having those preventative visits are important. And it also teaches the child that, if I focus on taking care of myself, and so on, I'm important. As I said, self-esteem and so on, it translates to so many other components of their lives.
Yeah, it's absolutely empowering. Are there any emerging trends or technologies in oral health that you're looking forward to?
I would say definitely engagement with nursing and nursing and the primary care professions, because, when you look at which provider has many touch points with a child. It's that nurse or that primary care provider, that pediatrician, and so on. So this is not, I would say, emerging as much as greater attention is now being paid to how nurses in their role, especially primary care nurses and maternal and child health nurses, can also be part of the education workforce, health workforce for oral health. So when that child goes in for a well-child visit, the nurse can also educate mom, dad, or whoever takes that child in for the visit about how to brush his or her teeth, healthy eating, and so on. Visiting the dentist at least once a year as needed, and so on. So it's really critical to have what I would call a full course, full court press on prevention. Prevention is key. And also, I would say the interprofessionalism, the fact that you don't see a dentist being educated without a nurse now being at the table in the way dentists are now being trained. So translating that to practice, this is an amazing new trend where oral health and good oral health for children is an everybody issue, just not the dentist being as the only provider being responsible.
What are some resources or tips that you would recommend for individuals and families who want to improve their oral health?
Brush twice per day, including at night, with a fluoride toothpaste. I would say fundamental practice also. We know the tips, fluoride works. Depending on if your child is high risk, the dentist would know whether or not to use fluoride varnish also. And that's like it's like painting nail polish on a teeth. It takes less than 2 minutes, but it's highly preventative for cavities if the child is high risk. And also nutrition matters also. Making sure that, limit the sugar intake. Limiting the sugar intake makes a difference also. But fundamentally, brush twice a day, including at night with a fluoride toothpaste. Prevention goes a long way.
My experience is that dentists don't really say it until they see a problem. Because I never heard my daughter's dentist say anything about sugar. That really is something that they should drive home, because that, as you said, that's such a huge driver for dental caries that should be like the regular course, not just healthy teeth, but not just unhealthy teeth, but healthy teeth as well.
And it's important to hear you say that, because children also educate their families. So we know that once a child is educated in a classroom, or we also do community events for families where we also have dentists volunteering, the impact is just not on the child, it's also on the whole family. So, and we send materials home also for parents. And so we also engage parents in education. So even if they may not get it at the dentist is still invested in prevention. It's making sure that we are also there in different avenues to reinforce that message, reinforcing messages about prevention and healthy habits. Children learn, and they eventually also educate their families.
Well said. Gillian Barclay, Senior Vice President of Global Public Health and Scientific Affairs at Colgate-Palmolive. Thank you so much for your work in protecting children's smiles.
Thank you. Thank you for having me. It was a pleasure speaking with you.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.